So in general, to make a definitive diagnosis of endometriosis, the only way to do that for sure is to do surgery, to do laparoscopy, so we can see if there is endometriosis in the pelvis, and we can biopsy or remove that tissue, and the pathologist look at it under the microscope and confirm that it is endometriosis. We can guess that something is endometriosis by doing imaging, ultrasounds, MRIs, can give us clues. This looks like endometriosis. It's probably endometriosis. The endometriosis that forms cysts on the ovaries has a very characteristic appearance, and we can be very highly sure that a cyst is endometriosis. But again, until we do the surgery and take some tissue from that cyst, we won't know for sure that it is really endometriosis. Endometriosis is associated with infertility. The worse the endometriosis, the more it impacts a woman's ability to conceive. There are studies to show that treatment of endometriosis improves pregnancy rates. There's a fair amount of controversy exactly how that occurs and why that occurs. If the endometriosis is affecting the ovaries and has large cysts on the ovaries, that may impact the ability of those ovaries to respond to stimulation and produce a good response with IVF. Also, if there are big endometriosis cysts on the ovaries at the time of the egg retrieval, when we're going to get the eggs with a needle, that presents other risks. So going into those cysts can increase risks of infection and complications after the egg retrieval, and may impact the quality of the eggs that we obtain. On the other hand, simply going to do surgery and try to fix endometriosis is not always a magic bullet that's going to fix everything. The surgery itself can cause problems. Removing endometriosis from the ovaries can damage the ovaries and lower the ovarian reserve, the number of good eggs left in the ovaries. So it is an individual decision that I always urge you to discuss with your physician to make the right choice for you, given your age, your ovarian reserve, the size of the cyst, and what the plan is for treatment overall. In general, doing surgery before IVF can potentially improve the outcome of that IVF cycle. So there is potential benefit to that. Also, we see in some individuals that the inflammation created from endometriosis in the pelvis can also impact the uterine lining, and that can potentially lower the chances of a good embryo implantation. And so treating endometriosis prior to transfer sometimes can improve the outcomes as well. And there's more than one way of doing that. So if we're talking for preparation for a transfer, sometimes surgery is a good option. Other times, taking medications to treat the endometriosis for 2 to 3 months prior to the transfer may be a better option for many people. So not one right answer that applies to everyone. And this is something that I decide on a case-by-case basis. And so I would definitely urge you to discuss that with your doctor.